Sciatica is pain, numbness, or tingling that starts in your lower back and travels down your leg. But honestly, here's the most important part of this entire video. Sciatica is a description of your symptoms, not an actual diagnosis. In other words, it tells us what is there, pain and numbness and tingling, but it doesn't tell us why it's there. Imagine going into your doctor and saying, I have shoulder pain, and after running tests and images and looking at your results, your doctor comes back and says, it looks like it's a painful shoulder. You're like, well, yeah, I know, like that's why I came in, but what do I do about it? What's causing it? Those are the answers that I hope to give you in this video. Because in reality, there's a lot of different things that could be causing your sciatica. And in order to get the best outcomes, in order to help you to resolve that pain, you have to match the treatment to your diagnosis or do the right things for your specific problem. And so my goal with this video is to point you in the right direction, to give you a better idea of what could potentially be causing your sciatica so that then you can have a better understanding of what you specifically need to do to help to resolve it. Hope this is incredibly helpful. Let's jump in. Now, in this video, we're going to talk about the 3 most common causes of sciatica that I treat as a physical therapist: a bulged disc or herniated disc, degenerative disc disease or stenosis, and a Piriformis syndrome. But here's most important thing number 2 that I can tell you in this video. I'm going to make some very general recommendations that should be applicable to the majority of people out there. Honestly, the best thing that you can do is to go into your doctor and have imaging performed to figure out exactly what's causing that pain. But for the time being, these should, again, give you a good idea and point you in the general direction. Now, that being said, let's start with the first one, that bulged disc problem or that herniated disc problem. First of all, what is it? Your vertebrae are stacked one on top of another in a column, and they're separated by a disc. Now, that disc has a tough outer layer and a soft water-based inner layer. It's like a water balloon, or some people will say it's kind of like a jelly donut. When forces are evenly distributed in your back, they're evenly distributed in your disc and everything functions great and normally. However, over time, that outer layer can wear out, and if forces aren't evenly distributed, let's say that we push a little too hard right here on the front, it can cause that disc material to bulge out into the back. That's where your nerves are, and as that disc bulge presses up against one of those nerves, that can cause that irritation, which sends those numb, tingling sensations down your leg, or those painful sensations down your leg. Typically, this happens a little bit younger in life. 20s, 30s, 40s is when we typically see the disc bulge type pain. Usually it's caused by activity, bending, lifting, twisting. Those are the things that usually will set this off. Oftentimes it's aggravated by sitting or forward flexing postures. Basically what that does is puts more pressure on the front of the disc, pushes the middle of the disc out into the back, which is where those nerves are, and that's what really increases pain. These are typically alleviated or made better by standing and walking. When we stand upright, those pressures are a little more distributed evenly. If we introduce a little motion, a little mobility, typically that's going to help that disc pain to feel better. Now, that all being said, what are some of the tests that we would do in the physical therapy clinic to see if we can diagnose this disc pain even further? This is what I would encourage you to try at home. The first thing we're going to do is what we'd call a slump test. You're going to sit on the edge of a chair or even on the edge of like your kitchen table, something that's a little higher that your feet are unsupported. From here, what I want you to do is slump. Round your shoulders forward, round your head forward, just sit with really bad posture like this. Now, if it's a really bad disc bulge, that might recreate some of those symptoms. But if that feels okay, now what I want you to do is slowly extend your affected leg. So if I had the sciatic nerve symptoms down here into my left, I would sit with this slumped posture and slowly start to extend my left leg. If that starts to reproduce those symptoms, we can be pretty sure that it might be coming from a disc bulge. Finally, if you can extend, and if that doesn't cause pain, try to pull your toes up towards you. Basically what we're doing is just trying to create more tension on the nerve to see if that reproduces any of those symptoms, and that's how we diagnose it. And so from here, my knee is extended, and then if I pull my toe towards me and that reproduces those symptoms, and then it's alleviated by pointing my toe the other direction or bending my knee, that's a pretty good indication that it might be that disc. The other thing that you can do, the other test that I would take you through in my physical therapy clinic would be a straight leg raise test. Now, honestly, this one's best done with the help of someone else. And so if you have a helper nearby, just ask them to lift your leg up and see what that does to your symptoms. But you can also do it by yourself. You're just gonna need a belt or a towel or a sheet or just something that doesn't stretch. Put that right here around your foot. And now with my hands, I'm gonna keep my legs straight, and then with my hands, I'm gonna pull my leg up into this position. Once again, we're introducing flexion into the back, flexion into the hip. I'm creating a little more tension down that sciatic nerve down my leg. And if I get to about this 45-degree mark, oftentimes that will reproduce those symptoms. Keep in mind, if it's a tight hamstring, that's one thing. But if it recreates pain and numbness and tingling, if it recreates those sciatic nerve symptoms, that can be another indication that it could potentially be a disc bulge. Okay, just one more important thing that I have to tell you before we start making these recommendations. If you do an exercise or an activity and it causes pain to decrease or sciatic symptoms to decrease, or it causes them to creep up your leg closer to your back, that's a good thing. We call that centralization, as those symptoms centralize up into your back. That's an indication that we're decreasing pressure on the nerve. That's probably an activity that you should continue to try out and see where that leads. If, on the other hand, you try one of these things and it causes pain or symptoms to increase or radiate further down your leg, we would call that peripheralization. That's an indication that we are increasing pressure on that nerve. That's an indication that that's an activity that we should probably avoid. So please keep that in mind as you try some of these things out. But here's what I would recommend that you try out for the disc bulge. Again, it tends to respond better to extension-based activities. So let's introduce some extension and see what that does to your symptoms. Lie down on your stomach, and then a good place to start is to just prop your elbows under your shoulders. My chest is just propped up slightly. I have this extension in my lower back right now. What does that do to your pain? I would hold that for about 10 seconds and then kind of come down here and lay flatter for about 10 seconds and then try that again. Hold about 10 seconds, repeat that about 10 times, and just see what that does. If that's good, if that helps you to feel better, decrease pain, or pain comes closer to your back, you could push into a little more extension. So now I'm gonna put my hands underneath me and get into this. We call it a half press up or a half cobra pose. Just introduce a little more extension in the back. Hold for about 10 seconds and come down. If 10 of those feels good, we could even press up into even more extension. And if you notice that that continues to help, and if you notice that decreases those sciatic symptoms, then we might pursue treating a disc bulge. I also didn't mention, I have videos for all of these problems, for the bulged disc, for the degenerative disc, and the Piriformis Syndrome. I have additional treatments and additional exercises in other videos here on my channel. I'll link all of those in the description down below for you to hopefully give you some more ideas once you have a better understanding of what's causing your sciatica symptoms. Okay, on to cause number 2. Next on our list is degenerative disc disease, or stenosis. Stenosis just means a narrowing of a canal, but what is DDD? What is degenerative disc disease? I mentioned earlier that our vertebrae are stacked on top of each other and separated by a disc that is very water-based in nature. And basically, over time, that disc loses its ability to retain water. That disc is also responsible for the amount of space between vertebrae. So early on in our life, we have 100% of space, but then as we get older and as that disc dries out, we have 90% of space and 80% and 70%, to the point where we are causing stenosis in that opening that nerve comes through. When it gets crowded enough, that's what can cause the sciatica symptoms down your leg. And so first and foremost, age is definitely a factor with this. Definitely start to see this one later in life. 40s, 50s, 60s, 70s is when this starts to creep in. I have seen it in younger people, but it's not typically that common. When we talk about the cause for this is one where people kind of say, I don't know, my back just started to hurt and it gradually got worse. They can't pinpoint like an exact date, an exact thing that was like, oh, that was the cause of my back pain. It just kind of starts in and then usually just gets worse over time. Usually this one's aggravated by extension activities and then alleviated by flexion activities. Usually sitting down helps this to feel better, or when you see these people walking, they've usually got a little bit of a round to their backs, just because it, again, opens up those canals in the back and alleviates some of that pressure and alleviates some of that pain. The last thing that I would mention about this is that it can happen down both sides. So if you have the sciatica symptoms down both legs, I mean, it's hard to narrow one side without really narrowing the other. If you have that down both legs, that can also be an indication. So again, hopefully this is helping you to kind of piece together your puzzle as you listen to what could be causing this. If we're going for a treatment for this, the simplest thing to do would be to see what flexion does to your pain. And so to do that, go ahead and lie down on your back. We're just going to perform the knee to chest stretch. If I had the sciatic symptoms down here into my left, I'm going to grab my left knee and pull it right up into my chest. And most people who have this issue will say, oh my gosh, that helps it to feel so much better. If that feels okay, go ahead and grab both knees, give them a big hug, and pull that right up into your chest and see what that does to those sciatica symptoms. If it causes it to decrease, it tells me that we might have a flexion directional preference. That simply means bending your back forward helps it to feel better. That could be an indication that you have some of this degenerative disc going on. The exercise that I would recommend for that would be the single knee to chest or the double knee to chest stretch. 3 times, 20 seconds is a great number to shoot for. The other thing that I like to show people with this problem would be a simple core move called a posterior pelvic tilt. Lie down on your back with your knees bent. Now what I want you to do is engage your abs, engage your core, and flatten your back down into the table. Hold that for 1, 2, 3 seconds, and then reset back to this neutral position. Engage the abs, flatten the core, flatten the back down, hold that 1, 2, 3 seconds, and then repeat that 3 sets of 10, about 20 to 30 repetitions, and see how that feels. If it is that degenerative disc problem, those should help it to feel better. Now, before we get to diagnosis number 3 on my list, I'm curious, has this been helpful? Has this pointed you in the right direction and maybe answered some of the questions that you have about your sciatica? I would love to hear your experience in a comment down below. In fact, it's comments on some of my other sciatica videos that inspired me to film this one, so I hope you find this beneficial. Again, if you're interested in checking out some of those other videos about more treatments that you can do for this pain and for these problems, I've got them linked down in the description. Okay, that being said, let's talk about number 3 on my list, Piriformis Syndrome. What is Piriformis Syndrome? Basically, you have a muscle called your piriformis that goes from your sacrum, or kind of the bottom of your tailbone, out to the outside of your hip. It is a hip rotator muscle. Your sciatic nerve, as it exits your back, has to travel underneath that muscle. If that muscle gets tight or irritated or aggravated, it can pinch down on that nerve, increase pressure on that nerve, and that's what causes these sciatica symptoms. The age on this happens basically to anybody, anyone from 20 to 60. I've seen basically everyone in between. Typical causes on this one: limited hip mobility, tight muscles. If you spend a lot of the day standing, especially if you stand kind of more on one foot, if you sit a lot with your legs crossed, or if you sit on a big wallet, those are all things that could potentially aggravate it. Pregnancy is definitely something. As your baby grows, it increases weight, and then as your hips relax and as your joints relax in preparation for delivery, that can put more stress on that muscle. These are all definitely causes of this piriformis syndrome. Aggravated by basically those activities that I just said, typically alleviated by stretching, by range of motion, by basically improving the mobility in that hip. And so how do you know if this is your case? And so what I would like you to do is try this. You're going to sit and cross your unaffected leg over your affected leg. And don't make fun of Dr. Jared's limited hip mobility. Basically, what we see here is that my left knee is up pretty high. I should be able to get that down closer to parallel. Hips are a little tight, something that I'm working on. But basically, I want you to take kind of a measurement of where your unaffected leg is at, maybe how high it is off of the table, how close we are to parallel. And then I want you to do that with the affected leg. And what you might notice is that that knee sits a lot higher. That means that we're limited in this rotation motion. That could be an indication that it's something we need to work on. The other thing that you can do is to test your internal rotation range of motion. Sorry, my feet are cut off on that one. But basically what I want you to do is sit with your knees straight forward and pull your feet out to the side. And what does that look like side to side? In most instances, the unaffected leg can pull out here a lot further than the affected leg. It just tells us that our hips are a little limited and a little tight, and we just need to work on that range of motion. We need to work on that mobility. And so if that's your case, here's the stretch, here's the exercise that I would recommend for you. Beginner level piriformis stretch would be to grab your affected leg and pull that knee up and over towards the opposite shoulder. So similar to the single knee to chest stretch, but now we're just going to introduce this line of pull up and over towards the other shoulder. You should feel that a little more deeper down there in that glute. Now, if that feels okay, I would go to the full piriformis stretch. And so now let's say that my right leg is the one that's affected. I'm going to cross that over my left leg with my hands. I'm going to grab here behind my left leg and then pull that up towards my chest until I get a good, comfortable stretch right here deep in my hip. I would hold that for 20 seconds and I would repeat it 3 times. And hopefully you notice, again, a change in those sciatica symptoms, a centralization, a decrease. That would be indicative of the piriformis pain. I hope you find this video incredibly helpful as you get a better understanding of your sciatica pain. Thank you so much for watching.